The Ghana Registered Nurses and Midwives Association suspended its strike, but this was only after Parliament's Health Committee intervened. Before this relief, the health workers paid no heed to public outcry, the government or the Labour Commission's legal action. Now, the association has been demanding full implementation of its 2024 conditions of service, citing prolonged delays by the Ministry of Finance. Now, the parties to the outstanding grievance will convene with the committee on June 26, and we're paying close attention to what happens next. And that's our focus in this edition of In this edition, I sit down with the Vice Chair of the Health Committee to help us unpack their brokerage strategy, balancing between demands being met and the government's ability to meet those demands. We'll also ask the crucial question, will the next meeting produce a roadmap concrete enough to prevent a relapse into industrial action? My next guest is Member of Parliament for Dafiama Busi Isa constituency. He's also Vice Chair of Parliament's Health Committee, Dr. Sebastian Sandaare. Doctor, welcome to Hot Issues.
Thank you very much.
It was the intervention of the Health Committee that eventually led to the suspension of the strike by the members of the Ghana Registered Nurses and Midwives Association. Why did it take the Health Committee 2 weeks long to intervene?
Yeah, thank you very much. Our intervention as Health Committee, I would say that we are happy and we are grateful to the nurses and midwives who form a very great workforce in the health sector for suspending the strike. I also thank my chairman and the ranking, in fact, all the committee members and all the parties, the Ministry of Health, Ministry of Finance, Fair Wages and Salaries Commission, and all the parties that were involved. We intervened because it was very necessary. We thought that we are the representatives of the people. The patients that go to the hospital and don't have nurses to attend to them, we also feel it. So we thought that it was very important for the committee, to intervene, realizing that we had gotten to a point where it's like hope, trust, was the issue. It wasn't like who was right or wrong, but it was like the parties now got to a point where they didn't trust each other. And we being legislators, being in the middle, felt that it was important for us to intervene. So the chairman and the leadership took it that it was important for us to call all the parties, to speak to them. So we ourselves made it clear to them that they hadn't taken advantage of all the necessary bodies that are there. Remember, even in Parliament, we have a committee called Petitions Committee, where when a group of people are aggrieved, they could appeal to that committee. And we are also there as Health Committee having oversight role over the health sector. So it took a bit of time, but we all thought that it wouldn't prolong that much. But when we realized that there was a need to intervene, then as a Health Committee, we intervened. And we are excited that our intervention really was like the magic one that worked. And the nurses and midwives suspended via action. But like I said, it's not any magic. We just created hope and trust for them to lean on.
We'll come back to that trust issue that you have mentioned. But this magic you speak about is only temporary, which means that as of now, or as of the time that they agreed to go on strike, we should be ensuring that we don't return to what the situation was 2 weeks ago.
That's right.
What is the committee doing about that?
Yes. What we did was, like I said, to appeal to the nurses and midwives to resume work or to suspend the strike, while the parties look at it to see what are the measures that really can be done so that they don't come back to strike. In other words, to find lasting solution to what we were seeing. So we gave 2 weeks to the parties that let the nurses and midwives go back to work so that the employer, can have free hands to continue with negotiation and see what really can be done. Because the health committee...
But what is the employer's concern about the demands of the nurses?
It's basically what we have heard over the weeks, that, their issues, the agreement package was not really budgeted for, and therefore it has implications on the budget, implications on the economy.
Did the employer explain why it had not been budgeted for?
Remember, this agreement, is something inherited. It's not the doing of the NDC government. We want power, and of course, governance is continuing. So we had to take over all the issues. But it's like that is where the problem was, as they explained to the committee.
Oh, but to be fair to the nurses, Doc,
yes,
it is not the only thing that the government inherited. The government, for instance, with the UTAX situation, only a matter of days, there were assurances for their book and research allowance exchange rate differentials to be released to them, which means that when the government of the day inherited that, it made plans for it. But why not the nurses that you inherit that and they didn't make plans for it?
Yeah, so if I may put it this way, and that contributed to our success. We were not there as Health Committee to judge the parties.
Okay.
In fact, the chairman did very well. And let me also say that the leader of the House, Honorable Mahama Yaraga, was also in there. But it was chaired by, the chairman of the Health Committee. The approach was to use a significant tool that sometimes people ignore. One was to listen to the parties. And I remember the chairman telling us, the committee members, that we're only supposed to listen first. So he gave opportunity to the nurses and midwives to narrate their side. After that, Fair Wages and Salaries Commission. After that, Ministry of Finance and Ministry of Health. We listened to all these parties. And each party was right in its own way. So at the end of the day, we're not like, okay, you were right, you were wrong, you were the cause of the program. No, that was not our rule. We listened to them. Then at the end of listening, critical listening, the chairman said, yes, members, you have listened, but you were only to seek clarification in case you didn't understand anything from the parties, which was the only thing one or two people did. And then the leader said, so in the midst of all of you being right, what can be done about this situation? Because our intervention, we wanted that leaving that room as conclave, we should have some solution. Even if there were a day of the nurses and midwives suspending the strike, it was very great because even day's work would save some lives. So at the end of the day, the role of the leader or the chairman was to say, look, we don't also want to say that nothing can be done about this situation. As a health committee, we believe that something can be done. So we are pleading to the nurses and midwives. Can you consider some period of suspension of the strike? And then the employer and other parties, can there be a room for you to look at what can be done so that we, using ourselves as the base or the basis for trust for these nurses and midwives, we were there to ensure that you would come back as parties in 2 weeks so that we will all understand what is government side of what can be done, and the nurses, what have you agreed that if you get this or all, maybe government can say, okay, after analyzing the situation, we can give you all. That is what the nurses want. But in case government cannot and says that, okay, in the interim, this is what can be done, while we look at the other issues in 2026, what could be the situation? So our intervention, and just pleading, the nurses and midwives said, okay, we'll go back to council to speak, and get their views before they could say anything concrete. And the employer, in this case, the Minister of Finance and the Minister of Health also agreed that there will be a room in the 2 weeks to meet again and see a lasting solution. Bear in mind, the suspension is just temporary.
Yeah.
And in 2 weeks, that is 26th of June, we all hope to see a lasting, solution where the nurses and midwives will not say that they are
right. So, essentially, both parties, employer and the nurses,
yes,
have decided to compromise on what used to be their entrenched positions on this matter.
Yeah, to us, that is how we will take it, because it was like there was no room for negotiation because each had taken some kind of position. So, but where we are, the solution would come out when we meet on the 26th, because for now...
So that June 26th meeting would determine whether or not this strike will be called again.
Exactly.
Or even government would have done something about it.
Yes, even from the press release of the nurses and midwives, they are also saying that they hope that the 26th of June meeting will bring some lasting solution. And that is what will determine whether they resume the strike or no strike. So we are working hard as a committee, as Parliament, to ensure that the 26th meeting would be something that will lead to a lasting solution.
I see. In working hard as a committee, between now and the 26th, what role will you be playing to ensure that the nation does not get back to where it was 2 weeks ago?
Talking to the parties behind the scene. Finding out from the nurses and midwives side what really is happening in their camp, what issues are they discussing. Assuming government cannot do all the things you want within this short period, what will be your views? And then, the employer, what can be done? Can we take advantage of maybe media budget to see that some of the issues, could be relooked at? So, like I said, we are doing that behind the scene,
right,
and hoping that the 26th of June meeting, there will be a lasting solution to this. And I want to add that we are not just only looking at solving the situation of nurses and midwives. I want to add that we're looking at a comprehensive, solution to health workforce, in the health sector.
What does that mean?
Bear in mind that the health sector is a complex one. You have a mix of categories of workers in there. You have nurses and midwives. Even among them, you have segregations. You have doctors. You have allied health workers. You have, name them. So the solution to us, our position as members of Parliament or members of the Health Committee, is that we don't want the situation where after government has addressed the issue of nurses and midwives, another group also wakes up that they're also going on strike because you have solved the problem of nurses and midwives. And in fact, that is the difficulty of the government, and that is why the position, has been careful, because government wants to address the problem comprehensively. But for now, we are dealing with nurses and midwives. But the solution really is to find a comprehensive solution to all the work, other workers, in the health sector. And the one of the issues was that other people are enjoying some benefits. I mean, we don't know whether it's true or not. So because others are enjoying, and the nurses and midwives think that they are also entitled to it, you realize that they are up. So
no,
if we don't have comprehensive,
who are the other
we didn't. If you, I believe that group, the nurses and midwives, they will be able to tell which other people are enjoying. But like I said, we have some solution. The focus moving forward should be looking at the solution comprehensively. As for the problems that led to the strike, I think we can leave them behind, maybe learn lessons from them, but focus on the solution. And that is what the committee is doing.
I'll take you up again on this comprehensive solution for the entire health sector. In the meantime, let's look at the outcome of the strike itself, because there are those who have asked the question, who should be held accountable for the many challenges we faced during that 2-week strike? What would you say?
I will answer by saying that all of us were responsible.
Who is all of us?
The employer, the nurses and midwives themselves, communicators. In fact, I want to dwell on the role of communication on this issue.
In this issue, all right.
What aggravated the situation was how we communicated on this matter. You see, we've gotten to a situation in Ghana where everybody is a communicator, or everybody wants to communicate on even specialized issues, whether on social media, whether on radio, whether on TV. Even people who don't understand the issue of nurses and midwives were communicating. So you had political parties, taking advantage, and everybody was talking to issues that they didn't understand. And you realize that some were communicating, and let me say, making the nurses and midwives angry. You understand? It's like you're in a situation, you want somebody to console you. You want somebody to appreciate the work that you are doing, even if the strike was not genuine. But in talking about it, you needed to appreciate the role of the nurses and midwives.
Did the health minister's communication anger the nurses?
I wouldn't say that. That's why I said all of us, and I could be part of it.
No, but you didn't talk about it. You were not in the news talking about it. The only people who have spoken to this issue from the sector, the health minister, the deputy finance minister, have both spoken on this matter. What was wrong with their communication?
No, they were bringing interventions.
Okay.
Aside these two ministers that you have mentioned, other people were communicating. And you agree with me?
You mean party communicators?
Party communicators, even people who were not party communicators, were all communicating. Such times, I believe, should be left for those who understand. Either the labor experts, the people who understand nursing and midwives issues, people who really understand the issue, that when they talk, everybody listening, and even including the aggrieved parties, would say that you have done or you have spoken very well. And that was one of the reasons or the factors that led to the success that the members of the health committee chalked. And the nurses and midwives listened. It's not that we couldn't talk. I mean, we're members of parliament. We are health committee members. We could all be talking in the room. But we created a situation of calmness. The room was quiet. Only very few people were talking. So the nurses and midwives realized that even as members of parliament, we were humble, we respected their views, we're not arguing to say that, oh, you are the cause, this is the cause. No. And that helped. So going forward, especially now that we have found some solution, I mean temporary, to the issue, I would plead that all of us, all those who communicate on this issue, should be measured so that we don't infuriate issues. Maybe somebody goes to say something that is not pleasant to nurses and midwives to say, have you seen? Because we have suspended, see what they are saying. Or somebody says something.
I mean, but while we're on the subject of communication, were you surprised by the politicization of the matter? Because mind you, there were those who said, well, the NPP government started this and the NDC government inherited it. And the GRMA is NPP aligned. That is why they are piling pressure on a new government to just implement this without caution.
Any issue that is politicized definitely will be difficult to solve in this country. And that's another lesson for people to learn from the health committee. If you come to the health committee, you have minority and you have majority. On this particular issue, we were one. We didn't talk politics. Even what the minority had done outside was for the optics. In the room, we had one objective and spoke and addressed the issue as one. That is what I'm talking about. What you can do or the solutions you can find when you come together sometimes. Ignore the partisanship and focus on the real issue. In this case, health. The two weeks or so, 11 days or so, all parties in this country were affected because the patients were coming from all divides. They didn't, sickness when coming would not say, oh, I'm going to NDC house, I'm going to MPP house, I'm going to PNC's house. So if nurses and midwives are on strike, one, your wife might be pregnant. Whether you are NDC, MPP, PNC, you go to the hospital and there will be no midwife. Your child may be sick. You go to the hospital and there's no nurse to attend to you. Meaning, to solve the problem, we have to come together, forget about the partisanship, and say that we need to solve this problem. We need the nurses and midwives to come back. And that was another approach that we used, that no politics in the room. Let's speak with one voice, with one appeal, that the nurses and midwives should come back. And
indeed.
So we also realized that those who were using the partisanship thing in communication to say that, oh, some of the executives of the nurses and midwives belong to this party A, party B. Even if that is the case, during this particular time, in communicating, that's not what you use. Because among the executives, I know that you have MPP nurses and midwives. You also have NDC nurses and midwives. And nurses were calling some of us to say that, look, we are executives, but we are NDC. We are MPP, but that's not what we want. We want solution
to the problem.
So those saying, oh, some of our members belong here, others belong here, is causing more harm than good. So when you go, don't take that path. Just speak to the issue and the solution will come. And that was what happened.
We'll look a bit more at that solution, especially because people have raised concerns about whether or not their demands as captured are realistic. We'll look at those when we come back. Don't go away. Back, it's still hot issues here on TV3. My guest is Vice Chair of the Health Committee. He's also Member of Parliament for Dafiama Busi Issa constituency. And his name is Dr. Sebastian Sandaare. Again, thank you so much for your patience. Those demands, because the end point of the solution is the demands they are making and ensuring that they are implemented. But when the list of demands started to come out, Ghanaians were worried as to whether or not the government should be paying for uniforms for these nurses who are already receiving basic salaries. You, as a medical doctor yourself, talk to us about really why such demands are made and whether or not we need them.
I'll be frank to say that issue of nurses, uniform for nurses and midwives, it's realistic. And maybe what the public doesn't know is that already government is paying for the uniform. So what they are looking for is just top up to meet current situation. So already it's something they are benefiting from.
But should government be paying for uniforms and their breast watches and things like that? It doesn't happen in the private sector.
When you go to the private, I wouldn't be able to tell, but when you go to the private sector, they're in uniform. The uniform really makes them identifier.
But why can't they get their own uniforms?
But why can't the employer support them with uniform? Where you are, maybe you don't use uniform, but sometimes it's a corporate policy that to motivate workers. This is what, apart from your salary, this is the extra mile we can go just to motivate the staff. So I believe it's in that light that government has taken it up. When I was working as a medical doctor, over 10 years back, this issue of uniform has been there. It is not a recent issue. It's part of their motivational package. And government thinks that, let's take it up to motivate them, to work for us. And I always say, we need a motivated workforce in the health sector. And in the light where many of our nurses, the last time I had over 5,000, and many more are still going outside this country. So, if getting uniform, I'm using the uniform because that's where your question is. If getting uniform for our nurses and midwives is one of the things that will make them motivated to stay in this country and work, I'll go for it. And that's why the government has gone for it.
So you think there's justification for it?
There is. And government is working hard to have a motivated workforce. What I'll add is that whatever that is within the means of government to do to make nurses and midwives in this country happy so that they don't go outside this country to work, I'm for it, and I believe members of the Health Committee would support my opinion. That is what is within government means. Because we can't allow our nurses, why are they leaving this country?
Surely
all we know that they are leaving this country. But the why they are leaving, we haven't researched so much. You can conclude by saying that, okay, they are not happy with their salaries and the working environment in Ghana. So why can't we take steps to ensure that the nurses and midwives trained in this country stay in this country,
right?
But
I mean,
work for us.
As you said, right, this uniform and breast watch allowance,
yes,
they're already being paid, right? It's already been paid.
Long time.
This is just an increment.
Yes.
So
according to my understanding.
So I mean, so if it had the capacity to keep them in the country, it would have. But obviously it doesn't. That's why they are still going out in droves.
Yes. And to clarify, you see, government, the position of government in all this is because of the limited physical space. Government is not saying that it's not right to give them uniform. Government is not saying that. Government is only saying that give us some time because your issues were not captured in the 2025 budget. But government knows what motivated nurses and midwives can do in terms of quality health delivery in this country. And I believe the kind of president that we have, His Excellency John Dramani Mahama, will do more things if you look at how he's fixing the economy. When the economy picks up, he would go beyond uniform. Other incentives will be provided. And that is why I'm saying that I believe the president's vision and where he's going is to come to a point where no nurse or midwives leaves this country, Ghana, outside the country, because they will be excited, they will be motivated, they will be working in an enabling environment. And that is what this government, the NEC government, has pledged.
I'll take you up on that. But then there is also 13th month allowance, which is 1 month basic salary for all nurses and midwives to be paid at the facility level on a yearly basis. And there is no indication here that this is tied to performance as is done in the private sector. This, as is espoused here or explained here, means that all the nurses will be paid this every year. Is there justification for this one too?
Let me say that, like I said, bear in mind I'm speaking as a member of the Health Committee, and the position was that we are not really there to justify the issues, but to appeal to the nurses and midwives to come back. They are back, and that is our joy. The package, the benefit, or let me say the agreement package that they have, we didn't really interrogate or ask for justification for all those issues they have listed, because doing that would aggravate the situation. But the 26th meeting, definitely government or the employer will come out with what they think is justifiable, what can be done or not. And the nurses and midwives will be there to also witness whether they agree to whatever position that the employer will be bringing. So I would say that the issues or the individual issues, we can take them after the 26th meeting. That is, if we don't have lasting solution, then we could be interrogating the issues. But we believe that where we have gotten to, the focus and the discussion, and even the way I'm talking, should focus on the solution
I see.
And how do we promote lasting solution to the issue so that I don't, in fact, even coming here, I had to talk to my chairman to be sure that I'm on track so that I don't breach even our own position to ensure that the way we communicate, the way we talk, does not offend any.
So you're telling us that at this time you're being diplomatic?
No, not being diplomatic, but being frank with the issues and being careful not to offend
either party.
Yes.
I want us to look at other aspects of the health sector, but perhaps a final one on the strike that has now been suspended, right? Because I asked the issue about accountability. Having admitted by themselves, based on what you have narrated to us, that, look, they didn't exhaust all avenues that they could have before going on the strike. The fact that they had ignored an injunction for them to return to work, because, again, that injunction was based on the fact that they had not exhausted all avenues before calling the strike. We have a situation where we lost workforce for 2 weeks. The implications have been reported all over the media space, and we are saying that there will be no accountability, whether or not that accountability will be taken from the government side as the employer, or that accountability will be taken from the nurses and midwives who went on the strike as staff. Would you just leave it like that and wait for the next one?
Like I said, our solution, our intervention was to find solution to this
and we'll pay them on top of that for the 2 weeks that they were on strike.
We took the steps to find solution to the strike.
Right.
And we have achieved that. The committee did not meet to discuss issues of accountability or who should we hold responsible or accountable for what has happened. We realized that let's put behind what has happened and get immediate solution. Believe me, if we hadn't intervened, probably by now
they'll still be on strike.
They'll still be on strike. I don't know, probably. And we would have lost more lives. And not just losing more lives, but patients having their conditions aggravated. Bear in mind, anytime you are sick and you don't have immediate medical care, your situation gets worse. And that probably may then lead you to death. We have averted potential deaths and aggravation of diseases that would have happened. What we don't want to see is the nurses coming back on strike. And I know they themselves, they are into a vocation. Look, to be a nurse or a midwife, it's a calling. It's a vocation. They are workers of compassion. As they attend to patients. Maybe you may have one or two who really doesn't show that compassion. But majority of the nurses and midwives are compassionate. They have sympathy, they have feeling for the patients that they see. And there's none of them that would truly, in his or her heart, say that they want a patient condition to get aggravated or they want a patient to die. They all want to see their patients healthy. And that's why I was saying that to do that, we have to come together as a country, employers, they themselves, all parties, including all Ghanaians, to be measured in the way we all communicate and try to find solution to this problem.
Right.
And it should be comprehensive. It should be comprehensive, like I said, not only...
When we come back from this break, let's talk about that comprehensive solution for the entire health sector, but we'll also look at other important issues to do with, healthcare delivery in this country. Don't go away. We'll be right back. back. It's still hot issues here on TV3. My guest is Dr. Sebastian Sandaare. He is Vice Chair of Parliament's Health Committee. He's also the Member of Parliament for Dafiama Busi Isa constituency. Doc, again, thank you so much for sitting with us. We know that some weeks back, the committee had gone around certain facilities around this country. Why did you find it necessary to do that?
Yeah, thank you very much. The Health Committee has oversight responsibility over the health sector. And you know, our aim or objective is to see, you know, a robust health system that attends to the needs, the health needs of the people of this country. So we watch for quality because they come to us for budget approval, you know. So at the end of it, the monies that are released, we wanted to see, are they applying it very well to ensure that our constituents have quality healthcare delivery.
And what did you find?
It was interesting. And I want to use opportunity to really show appreciation to the many health workers, you know, in the regions and districts, you know, beyond. Sometimes we think that Accra, Kumasi, and the big cities are where we see healthcare delivery. But when we went out, in fact, we divided ourselves into 3 groups because we wanted to cover a number of health facilities in the country. So I was a leader for one of the teams. So we went to Demongo, Tachima, you know, Tsunyani, and Goso. From St. Anne's Hospital, that's the one at Demongo, which is a CHAC facility, to Tachima, we realized that the workforce, very committed, sacrificing for healthcare delivery. And when I say the workforce, I mean the nurses, the midwives, the doctors, the administrators, allied health professionals. I mean, you could see they were dedicated and hardworking. That, you know, made us very excited and said, look, if we can motivate health workers in this country, they offer their best and be assured of quality health delivery. But we also found some challenges that affected quality health delivery.
What are these challenges?
And that cuts across, you know, all the facilities that at least the group went to. And that reflected in the other groups, their findings as well. There were infrastructure challenges because they had limited spaces. They could do more than currently they are doing, but realize that some emergency wards, some specialized units, they needed space, which they cried that, you know, government or stakeholders could intervene, maybe to get a ward or 2. I mean, infrastructure, just basically, let me leave it at that level. So that is one thing we have to do as a country, or government has to intervene. Staffing was an issue. Like we are talking about the nurses and midwives, you know. Attrition is one issue. You train nurses, you train midwives, they get to a point, some are leaving outside this country, leaving younger ones or old ones that you have to retrain again. So that was another issue that, look, government has to look at the issue of staffing. In fact, the right mix, maybe you may have some places, midwives, nurses are not adequate. The lower group of workers, cleaners. In fact, as for that side, mostly these days we don't talk about the cleaners, we don't talk about the orderlies, we don't talk about, the focus is on the higher group. But whatever it is, holistically, staffing was a challenge that government has to look at. And then equipment. It will surprise you to know that the whole of the northern sector, you can move from Wa to Techime beyond. Mammogram, a very important tool that tries to ensure that it can screen these days of breast cancer and other things that we are advocating for females or young ladies to screen. You won't find a mammogram around. You won't find other vital equipment. And then other issue that especially the CHAC facilities brought up was for government to ensure equity or kind of fairness in the distribution of resources. Sometimes when resources come, government might say, oh, they are CHAC. So, they don't matter, or the distribution may not be that fair. So the managers of the CHAC facilities, St. Anne, and then Holy Family in Techima, expressed that government should consider that issue of fairness to ensure that resources are distributed equitably. I mean, because there might not be time.
How many facilities did the committee visit in total?
I think about 11 or so.
I see.
Because
across the country.
Yes, across the country. We haven't finished. We are left with Central region, Western region. We haven't been to.
So we can say you are left with the Southern Belt.
Yes.
Okay.
Yes.
I see. Earlier you made mention of you wanted to check whether or not the monies you are approving are being used for the things that they come for.
Yeah.
And I guess you were referring to infrastructure and things like equipment.
Yeah.
Do you think that the money that you approve in Parliament are being used judiciously?
I would say so, but there's room for improvement.
Okay.
And more so, the committee didn't really go as auditors or go fully prepared to take books, interrogate, and we just wanted to, have a feel of the the healthcare sector outside the jurisdiction of Parliament, so that we don't sit all the time and they would have to come and then we only ask questions and they go back. And they were motivated. That's what I didn't add. They were motivated to see members of Parliament coming to health facilities. So at the end of the day, the committee, we're also excited. If going there, health workers are excited, then we should do more of such visits.
I see. Right. So, the important thing is that the committee finishes and then its work has impact on the challenges that you have seen.
Yeah.
So what next?
Like I said, we will finish. When we finish our work, the results will be, presented to the Speaker and Parliament.
Okay.
It's because we still have some facilities to do. But when that is done, the report would go to the Speaker, it will go to the House, so that we'll let the House know the work that we went out to do, our findings. Findings will be the positives and the negatives, the challenges that we need to look at and to fix. And that is where our focus will be, to ensure that we have evidence for His Excellency. Bear in mind, he's bringing a robust system for infrastructure, for human resource development, Mahama care, free primary health care. We have to lay the foundation for all these good policies by His Excellency John Dramani Mahama to take place.
We'll see how that plays out. So what are the timelines you're working with?
When we had our meeting, in the next week or two, we are thinking of moving to Central region, maybe Central Western.
To finish the work there.
But we are yet to have the exact date. But very soon we would.
How seriously is the committee taking the outbreak of Mpox?
Very serious. Any disease that affects our people, our constituents, Ghanaians,
but how
it's always
but how are you taking it seriously when we haven't seen or heard anything from the committee on Mpox?
Oh no, we work a lot. It's not everything we do that we bring it to.
Okay, so what have you done?
Just you know, we use parliamentary tools. One is, you know, the Minister for Health could come to the House to give a statement, or a member of the committee can ask the Minister for Health to come to the House and explain, and by that, explaining to Ghanaians the intervention. And just on, I think Thursday or so, the Minister for Health was in the House to answer a question on Mpox. And by that, telling Ghanaians and telling the House.
But that question was not asked by a member of the committee, was it?
No, it was.
It was asked by a member of the committee?
Yes, yes.
Okay.
But what I know is that, you know, government has taken the issue seriously. The strengthening of public health interventions like surveillance, you know, ensuring that there's contact tracing, and ensuring that public education goes on. And that's one thing I'll end with this interview. You see, hand washing is a universal intervention, but we take it lightly. It's not only for COVID-19, it's not only for Ebola. You realize that in this, the stress is on us to wash our hands.
Personal hygiene.
And I want to appeal to all Ghanaians, take hand washing as a very important, non-costly intervention for your own health care, for the health care of your family, your community, and the nation at large. Many of the diseases that we transmit, we could prevent them just by washing our hands with water and soap. If we don't have it and have the spirit,
you see that the numbers keep going up.
Yeah.
And members of the public are becoming increasingly concerned.
Yeah.
Based on what you have learned so far from the ministry and the Ghana Health Service, are you satisfied that they are on top of the issue?
Oh, I'm very satisfied. You see, in such infectious diseases, it's not only the numbers, but you're also looking at deaths, mortalities, and looking at admissions. But good for us, you realize that people are not dying from the disease. That could mean that our healthcare workers, the interventions are good. They easily pick the disease and ensure that nobody suffers or dies from the disease. So I would say that the government and the healthcare, the public health workers are doing very well in this regard.
Honorable, thank you so much for sitting with us.
It's a pleasure. Thank you very much for having me.
Dr. Sebastian Sandaare is Member of Parliament for Dafiama Busi Isa constituency. He's also the Vice Chair of Parliament's Health Committee. We've been looking at the health sector in its totality and some of the trending issues that have come up in the past week or so. Thank you so much for your company. This is where we bring our program to a close. If you missed it, there's a playback on our socials, including YouTube. I'm Kemini Amano, and this is Hot Issues. Bye-bye.